and welcome to Health and Exercise Practices. I'm module leader, Justin Haroon, and I just wanted to take a bit of time to welcome you. Now, your profession is rooted in science in its many forms, and in order to understand things like diet, exercise, behavior, emotions, you're going to need a deep and thorough understanding of that science, and specifically biology, but you can't rely just on biology. So if you think about a nutritional field that's relevant and that you'd like to work in, for example, obesity or eating disorders or exercise for an aging population, childhood exercise programs for improving well-being, your degree program is going to help you to deepen your knowledge, skills and practice in your chosen discipline so that you will be able to work in those areas. And at the end of your degree, you will have a disciplinary bucket, if you like, your disciplinary bucket, like a nutritionist or an exercise physiologist or a biomedical scientist, and you'll be an expert in your subject area, your bucket. And these categorical professional buckets are essential as they help us to study to the necessary depth to get a good enough grasp of the topic area with quite complex knowledge acquisition. However, they can also limit us. And if we look at human practices and behaviors through only narrow frameworks of disciplinary buckets, it is possible that we don't help populations, individuals in the way that we could. So it's important for us to take a interdisciplinary, multidisciplinary approach. That's a really useful thing for us to do. And this module is designed to help you to explore health and well-being from a multidisciplinary perspective. So if you're a nutritionist who goes on to specialize in a subject such as obesity, for example, you will be able to look beyond your disciplinary bucket to explore what other factors might be influencing the person or community, or indeed even broaden that, the society that you are working with, from things like healthcare systems to where the person lives in their neighborhood, from political decisions or political indecisions, political actions, through to things like architecture and city planning, from cultural beliefs to what a person's childhood might have been like. All of these factors will have an influence and impact on a person's life or a community's life and how they see the world, and therefore will have an impact upon their health. It's not that you'll be able to required or indeed have the skills to do anything about all of those other factors. That would be too much for anyone. But at least you will have a better understanding of health and well-being beyond your own disciplinary bucket. And at best, you'll be able to work competently within interdisciplinary and multidisciplinary teams and frameworks to enact real systemic change, which is what we're trying to do here. So understanding the complexity of being human is a bit of a messy business. And this module does not aim to give you the one solution or a solution or any definitive answers to society's most pressing healthcare issues. If the module could do that, there would probably not be a need for a module like this. It will, however, strive to broaden your perspective to help you understand issues from multiple perspectives, including, if you like, the client or the patient or the person that you're trying to affect change for or with, and to use your skills that you've learnt and that you will learn from your degree to be of service and help. And a final note on how we aim to work in this module. We will be looking at theory and concepts that are well established, and there are a ton of those. So we're going to narrow it down and focus on a core number so you understand how they work. We're also going to be looking at statistical data, data from government sources, data from health sources such as the WHO, and there's again a ton of data, and we will be looking at theory and things like that. However, we will also be looking to use our community to generate data, to generate lived experience knowledge, because you are all human beings living in the world, striving to practice health behaviors and sometimes not practicing health behaviors. You will be using knowledge that you find from sources to make decisions about your own health, your well-being, what promotes it, what gets in the way. So you are, in essence, theory makers as well. So we'll be using that knowledge generated from each other to position our understanding of behavioral knowledge within the theoretical context. So we'll be using that as well, and we will be looking to potentially develop theoretical understanding as a community, because that is a really important aspect of this module, helping people to work with communities rather than on communities, rather than parachuting in and going and doing something to a community, but working with communities to develop sustainable, innovative, real, systemic, lasting change. So we're going to be modeling that and doing that right from the beginning. It's integrated into the assessment, and I'm going to talk about the assessment with you from week 1, because we'll be starting to work on the assessment, on the coursework assessment from week 1, and then linking that into the exam at the end. So I'm really looking forward to seeing you on Monday morning. We'll be starting our first session at 10, and there'll be a Panopto link or collaborate link actually to come along and start that session, and then I'll be talking on that day about how we will structure the rest of the module. So we'll be talking about that. So it's going to be a blend of live face-to-face interaction and also guided work on Blackboard with resources and things to do as well. So looking forward to seeing you, and have a good weekend.